Morning, good afternoon, good evening. In this session, I'm going to take you through the enhanced monitoring and evaluation that will be done at Impact for TB Sentinel Sites. Why are we evaluating scale-up of 3HP? We want to determine the feasibility of introducing and scaling up 3HP in routine program countries, and this information will be important in future implementation. We will use an enhanced monitoring and evaluation approach, and we will collect detailed patient-level data on routine implementation of 3HP. The evaluation will be done in a subset of target sites that are deemed to be sentinel sites, and we will do this in at least one health facility in each of the 12 project countries. The primary objective of the evaluation is to describe the feasibility of implementing 3HP among people living with HIV and child contacts. Secondary objectives are to describe routinely reported treatment-limiting adverse events during treatment and to determine the occurrence of TB disease and all-cause mortality in people living with HIV and child contacts initiated on TPT. Our primary outcome measures are measuring feasibility, and we will look at uptake, treatment completion, and costs. These three will contribute to measuring feasibility. Uptake will be determined by looking at the proportion of patients eligible for 3HP who are initiated on treatment. Treatment completion is determined by the proportion of patients eligible for 3HP who are initiated on treatment. And we'll also look at cost of 3HP delivery and cost effectiveness. To note here that cost and resource use for providing 3HP will be collected from at least one sentinel site. Secondary outcome measures include adverse events, incident TB, and all-cause mortality. Adverse events will be measured by determining the proportion of patients initiated on 3HP who discontinue treatment due to drug adverse events. And we will also look at the proportion who develop TB while on or after completing treatment. And thirdly, we will look at the proportion who die from any cause whilst on or after completing treatment. The design is a multi-country observational evaluation whereby we will collect data retrospectively. The evaluation will be conducted at health facilities identified as Sentinel sites in the Impact for TB countries. And to do this, we have developed a common protocol that allows us to standardize the enhanced monitoring and evaluation data collection. Routine data, program data for the following population initiated on 3HP will be collected. People living with HIV, children less than 15 years of age who are household contacts of pulmonary TB patients. As mentioned earlier, Sentinel sites are a subset of target sites from which the Impact for TB project team will collect enhanced monitoring and evaluation data. The data will include routine patient-level information captured for a cohort of patients retrospectively from clinical files and registers at the sites. Data will be collected either through a monitoring and evaluation officer or other method deemed feasible by the in-country implementing partner. The patient-level data collected will be entered and stored on a locally hosted REDCap or DHIS2 database by the partner. De-identified and backed up onto the secured ORAM REDCap DHIS2 in South Africa. Important to note here that aggregate data collected at target sites will not contribute to this protocol. Bearing in mind, I mentioned earlier that Sentinel sites are a subset of target sites. We will collect data retrospectively, and as such, we have divided the data collection into two phases. Phase A, which includes data from the point patients are initiated on TPT up to a point they complete treatment. Routine program data documented during this period will be included, and this data will be collected 3 months after first clients complete treatment. The second will be the phase B data collection time point, and this is the point from where patients complete treatment up to 12 months after completing treatment. Phase B data collection is a once-off collection of data from routine clinic records, and we'll collect data on TB diagnosis and deaths. We will use a log to identify the correct patient records. And only those patients who complete treatment more than 12 months prior to the end of the project will be followed up. Otherwise, we'll not be able to collect the data. And important to note, phase B data collection does not require patients to come back to the project site. It is a record review. Other clinic level data that will be collected from facility heads includes average outpatient visits per day, number of inpatient beds, facility type, facility setting, number of HIV and TB clinical staff. This information will help us describe the facilities in which the implementation of 3HP is happening. In terms of sample size, we estimated a minimum number of samples of patients required for us to address the objectives mentioned above. Just bearing in mind, we collect enhanced patient level data, and we've based our sample size estimation on people living with HIV. Our assumptions include that we think people living with HIV, based on literature, who are initiated on 3HP, will normally be about 30%. And based on this, we estimated a minimum of 325 people living with HIV would need to be enrolled in the evaluation. Important to note, this is a minimum required. So each site that we identified as a Sentinel site will need to enroll or collect data on 325 people living with HIV. In terms of child contacts, we didn't estimate a sample size per se because current data suggests that a small number of children are identified through TB contact tracing. Therefore, we propose including all child contacts identified and initiated on 3HP. So we will collect data on all child contacts initiated. Our data sources include the Impact for TB data tools, patient registers for people living with HIV and child contacts. These have been shared with countries and reviewed by countries, some of which have adopted these tools. We'll also look at existing routine data sources, such as country-specific adverse event forms, data sources such as DHIS2, OpenMRS, and so on and so forth. Patient-level data collected at Sentinel sites will include baseline demographics, treatment information, including adherence and treatment completion, reasons for discontinuing treatment, including treatment-limiting adverse events, TB cases that may occur while on or following 3HP treatment, deaths that occur as well during this period, and cost information from patients and primary health facilities and laboratories in selected Sentinel sites. So just to summarize again the data collection time points and timelines. So day one, we assume the clinic will start 3HP initiations. Some clinics have already started. So this will be enrolling both people living with HIV and TB contacts on 3HP. And because it takes 3 months to complete 3HP treatment, we then have mentioned earlier that we will only start data collection 3 months after people complete treatment. This means then that retrospective data analysis or data collection will only begin at month 6. So in between initiation and start of retrospective data entry, we recommend that no no data is entered. However, country teams should make routine visits to Sentinel sites to check imperfect TB and TPT forms for completeness. This way, we'll then be able to collect as much data as possible by the time we start 6 months later. So at month 6, we will then begin retrospective data collection, which we have referred to as phase A. So we will collect phase A data from month 6. And this is 3 months after the clients complete 3HP or 3HR. Important to note here that the timelines will be different for those initiated on isoniazid preventive therapy. At the same time, the teams should also begin data consistency assessments, basically confirming if data in REDCap is the same as the data in paper forms. Then we will also collect phase B data, and we said phase B data will be collected 12 months after completing treatment. So if you then add the 3 months during which people will be on treatment, this is basically 15 months from the point clients are initially initiated on 3HP. So 15 months later, we will start phase B data collection. And for this, just to reiterate that we will use the link log to identify the correct patient records. And we will capture data related to death and TB diagnosis that may have occurred during and after completing treatment. We anticipate completing the evaluation at the end of August 2022. So we will stop phase A data capture. From this point, you will only conduct 12-month follow-up data activities at Sentinel sites.